At McMaster Children's Hospital, we're growing our staff, spaces, and services thanks to new investments from the provincial government.
Meric was born in 2013, happy, healthy child. Typical child, reached all of his milestones. Had a seizure out of nowhere in 2017, and this started our little journey with Batten disease. Took away his ability to eat, talk, his vision, his ability to walk. We made the decision at that point that we couldn't save his life, but we were going to save his childhood. And that was kind of our mission, and in came QoLA Care.
We care for children with life-threatening, life-limiting illness straight through to the end of their life and into bereavement. The purpose of our team is to work very collaboratively, building a network of support, making sure everybody's on the same page, supporting that child fully and well, and then supporting the family around that child. Into there comes schools and social workers, and making sure educators and education assistants are up to speed and aware of what good care looks like for this unique child.
My role is to see people either at home or reach out to them by phone, and I can help support symptoms related to life-limiting illnesses and help to navigate that with the goals of family in mind, whether that's with an assessment, coming to hospital, or supporting them in the home environment.
It's probably 2022. Meric was in the hospital 4 or 5 times that year, and we were back and forth, and Dad and I live in Milton and McMaster's in Hamilton, so we would just kind of tag team it, and one would sleep here, one would sleep there, then we'd switch off days and nights, and it was a lot. And we kind of started realizing, this is a lot of stuff that we can do at home with the right support, and we had that conversation with QoLA, and we said, we want to be home where we're comfortable. We want to be home where Meric's comfortable, where our family and friends are. They took that decision and they just ran with it. And I think, in this journey, and it's been a rough one, but I think the last year has been an incredible one that I did not expect. I did not think we would see last year. And to be able to have him so stable and managed medically and us supported emotionally, everything, to be able to do this in our home this past year is just a year I will never forget.
This extra funding really offers us the opportunity to provide the care that we've provided to Meric to more children. And so the way to provide the care that Meric's had, which is the best care possible in the home environment, that has all the expertise of the hospital available to him, is by developing roles that are specifically outreach roles. All of our team members will have an outreach role component, and together we're going to increase the level of service to children in their homes.
It's just made a huge difference in medical and comfort, absolutely, pain management. They've played an integral part in that, but also the support that they offer, the phone calls, the check-ins, and it was very comforting to have that connection to the hospital without being in the hospital.
There's nothing more important than having that relationship and trust with a family as you enter into the weeds of these issues. And I think having that continuity of care over time is just such an asset to overall good care.
Without this team, I think this journey would have been very different. We are very lucky.